Hi, I'm Dr. Anusha GP, Consultant Fertility Specialist at Cloud9 Hospital, Tanisandra, Bangalore. Embryo transfer is a very simple procedure and it usually takes only few minutes and it does not cause any pain. The procedure is preferred to done without any sedation, but in cases where the patient is very anxious or not cooperative, we do it under sedation. It is a daycare procedure. The patient comes to the clinic with a full bladder and the parts have to be prepared, and then the patient is taken to the procedure room, placed in the procedure cot in lithotomy position. The parts are painted with saline and draped. Then the cervix is visualized using a Cusco speculum. And then the embryo transfer catheter is taken. It is usually a thin, soft catheter. It has an outer catheter and an inner catheter. The inner catheter is given to the embryologist to load the embryos. Then under ultrasound guidance, the outer catheter is passed through the cervix into the uterus. So once the clinician is ready, the embryologist loads the inner catheter with the embryos and hands it over to the clinician. Then the clinician uses this inner catheter, passes through the cervix into the uterus under ultrasound guidance, and at an appropriate position, that is around 1.5 centimeter below the fundus of the uterus, the embryos are placed. Once the embryos are placed, the catheter is withdrawn and handed over back to the embryologist to look for any retained embryos. So once the embryo transfer is done, the patient is advised to rest for around 2 to 3 hours in the hospital and then they can go back home. Post the embryo transfer, the same day and the next day, we advise the patient to be on rest and relatively take it easy. But after that, they can be active. They can carry out their certain routine daily activities like cooking, washing utensils, folding clothes, etc. They need to avoid any form of heavy exercises like walking, jogging, running, or lifting heavy objects, and even intercourse. And better to avoid outside food and eat only home cooked food. Avoid any long distance travel. Take all the medications that is prescribed by your clinician on time. And you need not be on bed rest till we do the pregnancy test, because good circulation has to happen within the body, so the patient has to be active. So the pregnancy test is usually checked 2 weeks or 14 days after the embryo transfer. We prefer to do a blood test called beta HCG, but in places if the facility is not available, they can check for the pregnancy using the urine pregnancy kit to check if the pregnancy is there or not.